Effects of art experiences versus mindfulness, meditation, and reduction of depressive symptoms in elderly East Asian immigrants. J. Victoria Bays, Slovenko. Statement of the problem and selected literature review. The population of ethnically diverse older Asian adults in the United States is rapidly growing, especially in metropolitan area, which is in New York. Ku Chong and Joseph observed that depression is prevalent among immigrated populations, and in some cases, those who are going through acculturation are both depressed and abusing alcohol. Depression and alcohol abuse are intertwined. 2014, UNL stated, for Asian American elders, a multitude of cultural stressors and negative life events, such as a language, cultural barrier, social isolation, lack of support network and resources, financial hardship, and discrimination constantly were found to be associated with depression and alcoholism. Depressive behaviors are often seen in elderly East Asian immigrants as they adjust to their new country. 2016, Casado and Long found that immigrants who experience more intense migratory grief had a higher level of depressive symptom. A new review of literature on a topic as applied to East Asian from China, Japan, and Korea provided support for the observation that depressive behaviors are prevalent in these groups. Pang studied the symptoms of depression in elderly Korean immigrants, bringing attention of issue of how they resolve critical mental health situations such as conflict and emotional stress. Pang pointed out the stereotype that East Asian Americans have low level of alcohol consumption. However, drinking and addictive behaviors involving alcohol were constantly found in this population. According to the U.S. Department of Health and Human Services, seeking Asian immigrant substance users for abuser takes a much longer time than in a general population. In other words, it takes more effort to diagnose this population's mental health and substance abuse problem. Park thought, 2013, this was because traditionally Asian Americans try to resolve their mental problems on their own, believing that it can be maintained by avoiding bad thoughts. Despite the fact that the Asian American population's alcohol use and abuse in general has grown in recent years, the consensus on the alcohol-related and substance abuse problem within the Asian American community is that they do not seek it as a medical or social problem. Heavy alcohol consumption is considered almost normal protocol for socialization in Asian culture. Chi Ruben and Catano studied the differences in habits of alcohol consumption within a heterogeneous Asian American population who were men and women from China, Japan, and Korea. They found different variation of drinking habits within this group, from moderate to excessive. They found support for the hypothesis that this group's alcohol consumption was related to the degree of depression. Depression was related to assimilation, acculturation in United States. Within the field of art therapy, there's a little published research on the effect of art therapy on depressive behavior in population. A related study that used art experience was conducted by Endo and Ito. They used an art intervention to reduce tension or anxiety in 20 college students. The interventions consist of one 90-minute session followed by 30-question survey. They found changes in several areas, including the depressive mood of participants. The current study was designed to begin to fill this gap in the literature by testing whether our experience decreases depressive behaviors significantly more than mindfulness meditation in East Asian elderly immigrants who are depressed and possibly abuse alcohol. Hypothesis: our experience will result in significantly greater reduction of depressive symptoms compared to mindfulness meditation in elderly East Asian immigrants. Method: a pre-post test experimental design was used to test the hypothesis. Within group, comparisons were calculated before and after each of 5 sessions of our experiences or meditation. In addition, pre- and post-test differences between groups were calculated using Besserstat online t-test for colorated and non-colorated samples respectively. Posters were used to inform potential participants who partook in services offered by Family Touch for Asian immigrants. Family Touch is a non-profit organization to assist and strengthen immigrant families and low-income individuals through counseling service and educational programming. It provides a service to children and young adults aged 5 to 19, adult and senior citizens for social services, welfare, and counseling. Senior programs are designed to improve the physical, mental, emotional, and spiritual health of first-generation immigrants. From population of 50 elderly East Asian American enrolled in Family Touch, 10 people volunteered to participate. The resulting sample consists of East Asian immigrants, 3 Chinese and 7 Korean, 4 men and 6 women who were over 60 years old. They had a multitude of acculturative and life struggles and exhibited symptoms of depression. They were randomly assigned to either the art experiences or mindfulness meditation group. There were 5 participants in each group. Participants attended 5 one-hour sessions for 5 consecutive weeks. Each session began with the participant taking Beck's depression inventory and ended with their taking the same inventory. Therefore, scores on the inventory were collected at each session. The inventory was translated into Chinese and Korean by researchers. Art Experiences Group. The following art materials were used by our experience group: white drawing paper, markers, pens, clay, and collage materials. Different themes and our experience was used in each of 5 sessions. Session 1, drawing 2 faces: the face you show to others and the face you show when you are alone. Session 2, make a self-care box. Empty boxes of different sizes plus collage materials were offered with a directive. Create a box that makes you feel organized. Session 3, mandala drawing. Participants were given white paper with a circle printed on it and directed to drawing whatever comes to your mind. Session 4, draw a bridge. Participants were given 12 by 18 white paper and directed to draw a bridge based on whatever comes to mind. Reflect on your life and your current status. Mark where you are on the bridge. Session 5, pottery with clay. Participants were provided with a soft clay dough in many colors. They could choose to use their clay to make small pieces of pottery or anything you like. A clay pot was not required. They could make animals or whatever comes to mind. Mindfulness meditation. The mindfulness meditation group was provided with the meditation mats. All 5 sessions were conducted using exactly the same format and script. Good afternoon, and thank you for coming. Today we'll start by giving ourselves a reward for being here by clapping your hand. You can stretch all of your fingers and put them together to make a noise 10 times. To engage in mindfulness meditation, you'll go through breathing exercises and meditate for 8 minutes. The breathing exercise, which was 3 minutes long, consists of breathing in through the nose, holding breath for a second or as much as you can, then breathing out slowly. After breathing, they were directed to sit and meditate for 5 minutes with closed eyes. The researcher gave them specific direction about how to meditate mindfully. Result: scores on the pre and post test were used to calculate it within group differences and between group differences. The R experiences groups pre and post test scores for each session were calculated. Result indicated significant differences in depressive symptom reduction for each session except session 2, self-care box. The mean probability for the 5 sessions was P equal 0.0378. The meditation groups pre and post test scores for each session were calculated. Results indicate significant differences in reduction of depressive symptoms for every session. The mean probability for the 5 sessions were P equal 0.0131. This probability was stronger than the R experience group. Next, the differences between each group pre and post-test scores were compared. Significant differences were found between the 2 groups, which was P equal 0.04, with a mindfulness meditation group's scores indicating a significantly greater reduction in depressive symptoms as compared to the R experiences group. This is consistent with the findings in the within group calculations. The hypothesis stated that there would be a significant differences between groups and the greater reduction of depressive symptoms found in the R experience group. It turned out that there was greater reduction in the meditation group. Therefore, the hypothesis was not supported. Discussion. One can only speculate about why the meditation group made greater gains than the R experience group. It might be that meditation was more familiar to the group than R experiences, or that the meditation sessions were predictable, therefore decreasing anxiety. In the end, however, both groups benefited. Both experiences a reduction in depression based on data collected with the Beck's depression inventory. Limitation and recommendations. The study validity was threatened by several factors. The first was attendance. Some participants did not arrive on time because of transportation problems. A second threat was the accuracy of the translation of Beck's depression inventory by researcher. Third, The use of only one measurement tool also was a threat to validity. A fourth threat was a post-test sensitization. The time between the pre and post-test, plus the fact that they were conducted in every session, might have sensitized participants to the purpose of the interventions. Fifth, some participants might have wanted to please the researchers and adjusted their score on post-test. Sixth, group contamination might have been a threat because the two groups were conducted in the same room. And last, the sample size was too small to generalize the result to the whole population. Recommendations for future studies are to obtain a much larger sample, consider having the sessions conducted by a trained person other than the researcher and at different times, and consider giving the pre and post-test only at the beginning and end of study rather than each session. Thank you for your kind attention.